Welcome to this new episode of the Virulent Vortex, a podcast in which we discuss infectious diseases across scales, from molecules and pathogens to populations, pandemics, and everything in between. My name is Jaap de Rode, a biology professor at Emory University, and I'm also today's host of this show. And with me today, we have a special guest, Natalie Dean, assistant professor of biostatistics and bioinformatics at the Rowan School of Public Health here at Emory University. Natalie, welcome to the show.
Yeah, hi, Jaap. Thanks for having me.
It's a pleasure to have you, and very excited to talk about your research today. And as you know, we talk a lot about infectious disease across scales. Now, you're in biostatistics and bioinformatics, and so, what does that field bring to infectious disease, and how do you approach that?
Yeah, so I definitely consider myself on the border of biostatistics and epidemiology, though my PhD is in biostatistics, and I'm trained in biostatistics. The problems I've been interested in from the beginning have been infectious disease related. So starting with HIV surveillance and then moving into a study of vaccines. And I think what biostatisticians really bring to this type of research is an understanding of sort of how to design studies, how we sort of frame scientific questions as statistical hypotheses, how we think about data quality and data streams. And so there's lots that biostatisticians can do in infectious diseases.
Can you give an example of a kind of study that you set up?
Yeah, I think probably the easiest example to explain would be clinical trials. So clinical trials are a big undertaking where you're intervening directly on the participants. So they need to be enrolled, they need to be consented, and then they're randomized to some sort of treatment. And so that all requires a lot of intentionality and design. You have to think through what is your primary endpoint, what are you studying, how many people do you need?
So I know that you study Ebola, and I think that is one of the pathogens, or the virus that causes Ebola is one of the things that you study, and that is where you apply some of these designs to think about vaccination. So can you tell us a little bit about Ebola and then what you're doing to try to understand the best ways to vaccinate against it?
Yeah. So when I graduated with my PhD, then I moved down to University of Florida, and I became, during my postdoc, that was 2014. It was the height of the West African Ebola epidemic, which was the largest epidemic of Ebola that we've ever seen. It really orders of magnitude larger than what we had seen in the past. Previously, they had been quite contained, maybe 400 cases, and this was not over 10,000. So I got involved with the design of a vaccine trial. So there was an effort, there had been some vaccines that had been developed over the course of over a decade that sort of had been in development. But in order to test if an Ebola vaccine protects against Ebola, there has to be Ebola circulating. And so when the epidemic was really at its height, there was a big push from WHO and government agencies to start to design trials to assess the performance of the vaccine. And so I became involved in a trial that was with WHO, and it was run with the Ghanaian Ministry of Health. And what we did is we evaluated the vaccine using this sort of unique approach called ring vaccination. So ring vaccination has its origins with smallpox eradication. Basically, you identify a case through your surveillance system, and then you identify their contacts and contacts of contacts. You make a ring around that case, and that's who you target for vaccination. And so that became the basis of a trial. And so by randomizing those rings, we were targeting people who were at highest risk of Ebola, of exposure to Ebola, and we were the only trial that was able to generate data that vaccine actually worked, protected against Ebola. And that was many years ago, but that's still one of the most exciting projects that I've ever been involved in because of just the speed and that it was successful, against really a lot of odds.
Yeah, so when I think of a ring, so I'm envisioning a ring like in a landscape, but is that how I should think about it? Or is this more kind of like a social ring that you really think about the people that are interacting with these people that potentially can spread the virus?
Yeah, there's many different ways you could define a ring. In the context of that particular trial, it was defined socially. It was based on contact tracing. So the contacts of that case and then their contacts. So it could include people who lived kind of farther afield. But what we've been researching since is kind of how can you apply ring vaccination to different disease contexts? And maybe if you're looking at a vaccine for a mosquito-borne virus, maybe you would think about the ring as just defined based on geography, because that would be better suited for the epidemiology there. So I guess the question is, did the vaccine contribute? Well, so there's a few things in there. So one is, was there a risk of a global pandemic with Ebola? I don't think so. But I do think that there was some potential for it to spread more than it did. Certainly there was a big concern about Nigeria and like other parts, high densely populated parts of Africa, and these population hubs. And if it spread there could have been many, many more cases. As for whether the vaccine helped control the epidemic itself, I mean, I think it probably had some contribution, but really, by the time the trial itself was rolled out, it was on the tail end of the outbreak. But since then, there have been large outbreaks, like in the Democratic Republic of the Congo, and I do think that it has contributed. As certainly protecting healthcare workers and frontline workers.
Yeah, definitely, and using one outbreak to learn and then apply it the next time.
Yeah.
So you talked about contact tracing, we talked about this ring, we talked about pandemic. So as a lot of people are aware, we have had this COVID-19 pandemic. And so the contact tracing that happens there, you know, when you get infected, you need to let all your close contacts know. Is that similar to what you just explained in terms of Ebola?
Yeah, it's the same basic principles. But I think that the effectiveness of the intervention varies based on the sort of the features of the pathogen. So Ebola is spread through very close direct contact with bodily fluids, and it's spread, you know, think about like through family members and people who are taking care of someone who's very sick. So there's something much more predictable about the networks through which it spreads. So taking the time to go and ask someone who their contacts are, so there's you can get a little more information there. Then I think with COVID-19, for example, it became challenging as the numbers got much larger and there was more spread that happened sort of before even someone had some. So
the lessons that you learned from studying Ebola and the vaccination, how has that helped with SARS-CoV-2? Or, you know, and how will it help with new pandemics that we don't know yet? Yeah.
Well, I think Ebola caught a lot of people unaware. And after that, there was a lot of real reflection about what can we do in advance of an epidemic to be better prepared to evaluate new vaccines, therapeutics, diagnostics, everything like that, to do that sort of research. And so that led to the establishment of several organizations. So the World Health Organization launched their Research and Development Blueprint Initiative. So I've been involved in that. And it also led to the foundation of CEPI, which is the Coalition for Epidemic Preparedness Innovations, and they've supported a lot of early work. So they've been funding sort of the development of Middle East respiratory syndrome virus vaccines.
So there's the research, there's the science, and then there's implementation. And so in between those things is communication. And I know you have been involved in a lot of science communication during the pandemic. You have been talking to a lot of journalists about this. And so if you had to sum it up maybe with one thing that you learned we can do better in the next pandemic, what would it be?
Oh, the big we about communication? That's challenging. What can we do better? Well, I mean, the one thing that comes to mind, and this is not my area of research, so it's not, you know, it's more like just a call in general, but more social science research. But when we, you know, given an effective vaccine, you still need to figure out sort of the messaging, the communication, all these things. And the people who do the hard work of understanding those patterns of confidence and uptake and, you know, communicating these policies and things.
Social science. Now, as a statistician, you know, your bread and butter is uncertainty. Right. And I think that is also something that came through in this pandemic, that maybe early on scientists didn't have the answers, but they felt like the public wanted an answer, so they gave the answers, and sometimes they weren't real, rather than saying, we think, but it may not be true. We need to wait, right? Is that something that we can do better too?
Yes, definitely. And yeah, I think it's challenging to sort of hit the right level when communicating about a complex topic, because you don't, as scientists, I think we're inclined to give all of the little bits and bops and caveats and if this and that. But in the end, we do need to simplify it down to a core message and sort of what does it mean for that person. Yeah. But I think one thing we didn't do a great job of is previewing how that message may change as the science itself evolves, as our understanding evolves, as the biology evolves. I mean, like I think about new variants and with COVID and how that changed kind of how we thought about policies, or how we thought about how well the vaccine was working, or as things, waned, or how well does the vaccine prevent infection versus preventing severe disease. One thing I've tried to do personally is kind of, okay, you say what we know now, but you make it clear that, okay, this is what we know now, and kind of previewing, this is the way things might change over time. Yeah. So, this is, our current understanding is this, but if there's a new variant that is more severe, then the policies might change in this way, kind of previewing a little bit. Yeah. But it's tricky. And also you can, as a person, say something to a reporter, and who knows what will land in the actual quote.
Yeah. That's not a problem.
Yeah, that's a challenge.
All right.
Too.
Well, this has been really great. Really nice talking to you, and very enlightening to hear everything you had to say about vaccination and these outbreaks. We hope you enjoyed this episode and will join us for the next one. Thank you for watching.